Hello, everyone. We can start.
Hi, good evening, everybody. This is Dr. Wang. We will today be talking about the Asians versus European beauty standards in aesthetic medicine. And I've been working for in the field of aesthetic medicine and family as a feminist physician as well, and as a traditional Chinese medicine practitioner as well. So I think that we can probably start slowly. And if there's any question towards the end of the presentation, feel comfortable to just typing or raise your hand or whatever just to ask questions. Feel comfortable. Next, so what comes to my mind to talk about this the differences between the Asian standard and the European standards. I think it's because over the years I've been practicing between this, like two different field, let's say, and I find it personally very interesting that there's quite a difference, not just the standard, not just the beauty standards. It's also, of course, it has something to do with the cultural, it has something to do with the weather, it has something to do with a social standard as well. And at the same time that um, I think that it's practical to actually to have like a introduction and a list to know a little bit about the differences, because nowadays people travel around the world and you never know what comes to your clinic next, right? And at the same time that I think that like globalization is actually very important as well, in a way that like patient might come in, he or she might be living in like a foreign country, but then like the patient would like to look great as well. And it doesn't matter where you're from, it doesn't matter like what's your ethnicity. But I think that like as long as you can get familiar with the patient, with their facial structure, for example. And I think that that would be very practical. And of course that I think that's another issue, that the standardization on social media. I don't find it of course, it's like it varies from person to person. Every single physician has their own opinions. I think that from what I'm saying, it's just that the standardization on social media, that there's only one type of beauty. There is only this. There's only that. I don't. I wouldn't say that's actually really, it doesn't make sense in my opinion, because everybody, they have their different expectations, of course, that I understand. But then you couldn't be asking, okay, so there's only, for example, this little space to put in the fillers on the patient, and then like, but that patient wants to look like the other person on some social media. That wouldn't make any sense. Hence, I wouldn't say that there's only one type of beauty. I would say that of course, you have to base on the anatomical perspective and the possibility, and what is actually doable from from what the condition of the patient, and you can decide later. The next is the cross ethnic treatment demand. Mm, as I mentioned, like some patient might be, like coming from another country, or they might be having a mixed background, or like cross-ethnic background, and I think that that is actually would be helpful to understand their facial structure, and then have a little bit of like information regarding how you would like to deal with it too. This is why I think that it's quite an interesting field and topic to talk about the differences between the like the Asian standard and the European standards today. So when it comes to anatomical differences, as you can see here, that when it comes to Asians, that we have like a little bit of flatter anterior projection, and wider and more lateral zygomatic bones, and generally the mandible as well. It will be a little bit, it will be a little bit wider. There will be a little bit wider, with actually the wider genial and again a genial angle as well. And when it comes to the Europeans, then the zygomatic bone is more anterior projection. And besides that, the mandible, for example, here, like the lower part of the chin, it will be sharper. It will be more angular. The jawline will be more sharper as well. And when it comes to the necks, what about the skin? So generally, we all know that in Asian we have like a slightly thicker dermis, and Europeans has a slightly thinner dermis. And at the same time, that when it comes to skin quality, Asians are more pigmentation prone, and when it comes to Europeans, they are more wrinkles prone. Differences when it comes to the aging. So what is important to actually get to know about the agent is when it comes to, let's say, Asians that, the sagging comes a little bit later in like a later stage, but it does happen. As you can see that in a picture from the left to the right, it's a Caucasian, and the second from the left is African American. The third from the left is the Latinos, and the right is Asian. So as you can see, sagging happens when it comes to Asian in a later stage, and when it comes to Europeans, so that generally Caucasians, they have like an earlier volume loss. So due to all those differences, so first, of course, we gotta talk about, the different definition when it comes to, beauty standards from the society, or the differences of the expectations from like different cultures or different ethnicity, for example, between Asians and Europeans. So what is an Asian ideal and what is a European ideal? Asian ideals, basically, it's more about like, having like a V-shaped face, like, like a thinner, or like that, say that, like a more narrow shaped lower third, and the less protruded zygomatic bone, compared to Europeans, where they prefer to look more angular contours, for example, stronger cheekbones. And when it comes to skin quality, what generally are the aims for the Asian population is they really look for like a really good quality and the tone and texture of the skin. But when we actually compare it with Europeans, it's not that it's not important. Of course, it is important as well. But if we actually have a little bit comparison between the Asians and the Europeans, they focus more on lower the basically having less wrinkles, so they are more wrinkle focused. Of course, due to, as we talked about earlier, that about the skin quality earlier, the skin differences, type of skins, and at the same time, that of course that in Asian population they would look more for the enlargement of the eye, but if we compare it with the Europeans, then generally that they look for like a more raised eyebrow, while whereas the Asians, they actually rarely ask for example, the Botox for the eyebrow lift. And lips is another interesting topic as well. I hope I'll be able to talk about it in another session. But generally that when it comes to lips, what is very interesting is that for most of the Asian patients I've had, that they don't look to have like more volume. They look for like to have a defined borders, like to have like a more defined shape of lips. As you can see, actually, I think in the next picture that will be actually much more clear as well. That they look for like a more clear border of the lips. And while Europeans, or let's say Caucasians, that the population that will be looking for the volume focused. Of course, that like shapes are important as well. I'm just talking from the perspective of after having certain quantity of patients, then that's the majority of what I see. And from the picture on the right, actually, as I mentioned earlier, you'll be able to see that on the right side, I think this is Kardashian, right? So she actually, has like a much more angular face than the one on the left. The left part is basically, we call it like in Mandarin, call it like an egg shaped face, and they prefer to have less angles and then like more smooth looking skin quality as well. And yeah, and basically the all almond shape eye as well. Okay, so treatment logic versus patient expectations. So as you can see on the right, on the picture, that what do we do? What do we focus on? Since there's differences between the expectations, the beauty standards as well. So what do we do with it? Generally, we need to avoid the over projections. And the fillers are more focused on the midline. What does that mean? So that in Asian population, it's actually quite often to have the fillers on the forehead, which is the midline over here. So they will focus on the fillers on the forehead, the fillers, of course, on the nose, and basically the fillers on the lips. But then in order, they prefer very often, they're very commonly that they prefer to have the lips actually more protruded to the front. So of course that actually affects the method of how you inject the lip filler to how you inject the fillers to your lips when it comes to the Asians and the Europeans. It's different method. And besides that, usually I think that in Asian populations that they try to have like a minimum quantity of fillers. And besides that, what I would do very often and ask very often is for the chin elongation and the narrowing. For example, when you combine with the Botox, the masseter Botox bruxism for bruxism. And because when you do Botox for a masseter reduction, what happens is that you actually solve the problem of the bruxism at the same time that you will be able to narrowing a little bit by the Botox, narrowing the mandible, the masseter muscles. And the cough reduction is another, common procedure. Cough reduction by Botox is another common procedure when it comes to Asian populations as well, whereas that it does not actually happen a lot, and it actually is rarely asked in the European population. And that when it comes to the energy devices, I would say that, of course, when you have an Asian patient, it's very important to be aware of the post-inflammatory hyperpigmentation risk. When it comes to European, so as I mentioned earlier, that usually they will want to have like a more angular structure, enhanced structure, and the lateral volumization. So meaning that, for example, zygomatic bones, for example, the chin projections. And when it comes to the usage of Botox, that actually there are a lot of patients that's mostly focusing on the upper face focus. So strategy. I think that when it comes to the strategy of injection with the Botox, with the basically Botox filler and all the aesthetic procedures, compared to Asian or compare it to the Europeans, that the Asians actually they are looking for more of a contour and the slimming of the face, and also the skin quality focus. It's actually, I think, much more in a way, it's much more focused on skin quality than the European population. That, of course, it comes to, it's just in my practice. And when it comes to the volume, Europeans, of course, that will be focusing a little bit more on the volume and lift. For example, the lips, that in usually like the European populations when they come to me, and that they were focusing on, how much were it was it added, and they would like to have like a bigger and more shaped and more prominent lips, for example. And when it comes to the Asian population, they usually come in and ask it to have the shape changed a little bit in a way that they would like to have a more defined structure when it comes to the lips. So you can see, actually, I think the picture on the right is really actually, when it comes to lips, is actually a rather interesting example as well, because they look very different. They have different expectations, and the European population, that they, due to their strange skin structure as well, that and due to volume loss in the earlier stage, that they try to have like a wrinkle focused procedure as well. So overcorrection risks. When it comes to Asians, I think that it is rather, I would say that it is rather important to not to overfill the mid face. And as the picture on the right, with the right lower one, that it is the example of overfilled mid face, meaning that, as you can see, there's a filler actually on the forehead, which is actually a little way too much, because then it protruded so much that it actually is losing its balance between the nose, the forehead as well, between the nose, forehead, and the cheekbones. And at the same time, that I think that, in my opinion, I think that in this, actually in the middle part, right under eye area, I think there's too much of the filler as well. Besides that, there is the chin. I find the chin a little bit too long for her. But this is a very common mistake when it comes to like the expectations of patients, and at the same time, that I would say that it's very important for a physician to figure out what is the good balance for the facial structure of every single individual patients. And when it comes to the Europeans, I would say that the underdefined structure. For example, this patient actually is the patient that was she came to me. She was actually asking for extra filler. So this was what her lips look like. So she came and asked it for the extra filler, and I was like trying to convince her that, unfortunately, I wouldn't recommend, because, well, I think first of all, the amount of filler is already a little bit more than I would do, and at the same time, that the shape is really not so ideal, in my opinion. But I think that the most of the issue from, for example, from this lip that we're talking about right now, is that I think that the shape, it was not well shaped. It was mostly focusing on the volume, but the shape was not properly done. So this is basically one of the mistakes that I've very often seen between Asians and between European populations. So what's the SOP? I think that like the last time when I was doing the webinar, I think that I did mention about the most important thing, which is the communication and the safety for patients. But that's from the start. From the start, let's go from the start. The start is, of course, that you first come to me, and then like when patient comes to me, we need to first check the. Well, of course, you have to check the anatomy assessment, and in of course that the ethnicity it matters as well, in a way that you need to check their facial structures, the zygomatic bones, what's a balance that will be great for them, and what are their expectations. And when they start showing you, like especially when patients are explaining to you about their expectations, I think that the best way to communicate with them is for them to show you, like, be more as precise as they could. You need to ask them to be as precise as they could, because then like even if they're trying to describe something to you, still there might be like a differences of understanding between physician and the patient. So that is very important. It is very important, and I believe that it's the physician's responsibility to understand properly, precisely what is the patient expecting. And only by knowing what the patient is expecting, then you'll be able to communicate with the patients and basically explain it to them. Okay, whether this is doable, whether it's not doable, do you agree? Do you not agree? And whether you think that, what you think as a physician, whether it's going to be aesthetic or not. And at the same time, that of course it's very important for us as physicians to decide whether that will be within a safety range for the patient or not. I find that very important, because sometimes I would even say that quite, I wouldn't say very often, but then sometimes you do meet patients that prioritize their expectations about every single thing. And that's exactly why that, in the next PowerPoint, I'll be telling you that, like, I think that, it's important to know when to say no. And based on, after the communication between the patient expectations and, of course, within the safety range, and after assessment with the anatomy structure of the patient, and then you'll be able to create like a proper individual plan for them. And I think this is how you create a trustworthy relationship between you and patient as well. So here comes the common mistakes. Well, the common mistakes is that I think that, of course, when we first started, when everybody first started, the aesthetic, let's say the road of being an esthetician, the career of being an esthetician, that you will learn one technique, you will learn two techniques, you will learn more techniques on the way. But you should always understand and remember that every single patient that comes to you with a slightly different expectations, with a slightly different facial structure, slightly different, let's say, conditions, then you cannot use only one technique. You cannot copy paste the technique on every single, for example, lips, for example, Botox. There is no way you can do that, because it will give you a different result. Simple that. It gives you a different result. And at the same time, I think that, you should always at the same time learn different techniques in order to have the access towards the different types of, for example, cheekbones, different types of chins, or different types of, for example, forehead, for example. And of course that, patient satisfaction has nothing to do with technically correct. You might be technically correct, you might be successfully avoiding, for example, like avoiding occlusions, of avoiding everything, and then you might be on the safe side, but then patient might in the end still be not satisfied with it. For example, I had a patient with very thin, very thin lips. I did tell her that, I did communicate with her. I did talk to her about, what she should be expecting. And lucky enough that, she did well, I would say that, we actually, the communication itself went on went on not a short period of time, but then in the end she did understand why, her lips will not be able, it's just not physically possible for her lips to look like, the ones that you see on, I don't know, Instagram or so. But you always have to understand that. I think that, in me personally, I think that in SMS, and the key point is really communication. It's always communication, safety, and communication. They understand, patient will understand when you explain it to me, like in detail why. And explain to them in detail why it's not doable, or why it is not possible. I think generally that patient would be willing to understand. And if not, then, well, too bad. Miscommunication. So, as I said, communication is always the most important thing. This is why that the miscommunication would create like a gap between the expectation from patients and the result. Hence, before doing anything, I think that always make sure you communicate with the patients, and make sure they understand, like side effects, or possible side effects, or like what to expect after the procedure, what to do, what not to do after a procedure, for example. um, and yeah, what is important, in my personal opinion, I think it's very important to know when to refuse. Because, for example, you cannot, it's just not possible for you to ask an Asian population, like, for example, Asian patient to, um, I don't know, for example, to have for Asian patient to have a very, 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 like, for example, very, very launching, for example. Like, there are certain procedures. Basically, what I'm trying to say is there are certain procedures that it will not be achieved through aesthetic procedure, aesthetic, like invasive aesthetic procedure. It will only be achieved through like aesthetic surgical procedures. So, like, assess it well. I would say that assess the possibility and anatomical structure of the patient well, and then later on, when patient have rather unreal when if it happens that patient has rather like a little bit more unrealistic expectations, then, and if patient still insisted after as a physician that you repeatedly explain to them, then I'd say that it's important to basically refuse, or just you can simply tell them that maybe go to like a surgeon, they can assess it for you, and you can decide. Okay, harmony of balance. uh, that is a little bit rather like a personal assessment from my side, that I think that like uh, ethnic preservation versus transformation, it has to have a balance. So sometimes that for example, some Asians, they will be looking to have like a much more like anterior protrusion, interior projection, which wouldn't look nice on them. And I that would be up to you. But then, if still within a safety range, then it would be really, to be honest, up to you to decide whether you want to do it or not. um, but yeah, but personally for me, I think that there has to be a harmony of balance, because in the end you will be the one that's doing the procedure, and you will be the one that will be carrying the responsibility of the result. So I would say that it's important to find your own balance when it comes to the procedure, and when it comes to the procedure, and basically the your standard of beauty, let's say. Okay, so well, as this famous Narita Joy, that she basically says that an esthetician must think like a chemist, treat like a doctor, and create like an artist. That's it from my side. And if you have any questions, please feel free to rather either type in or just raise your hand, ask the questions. Thank you very much.